Meniscus is a soft cartilaginous structure inside our knee that protects our knee during range of motion, keeps it in center, and protects our knee from injury. The younger people have stronger meniscus than older people because once we're younger, the meniscus are more strong and has more blood supply. So meniscal injury can happen to anyone, to young people, to children, and older people. Usual meniscal injury happen from injuries such as running and twisting the knee, playing tennis, playing basketball, as well as falling and twisting our knee, or being involved in some type of the accident, motor vehicle accident or work-related accident also can injure a meniscus. There's several type of meniscal tear exist, and they're all different. There's a tear when the meniscus turns from the back towards the base of meniscus. Meniscus has 3 layers. It has outside layer, middle layer, and a back layer. The back layer has more blood supply. And if the back layer is turned and meniscus dislocated, the patient knee can lock in a certain position, and patient is unable to unlock it because they have severe pain. It's called locking of the meniscus. So the meniscus have to be reduced for a patient to extend their knee again. That type of meniscal injury, in my practice, treated with meniscal repair, and also depends on the age of the patient. I preserve meniscal repair for younger patient because rehabilitation process for a meniscal repair is a little bit different than just do partial meniscectomy. The different type of meniscal tear, when you have more superficial meniscal tear and more superficial layers of meniscus, has less blood supply, and repairing that injury most probably will not result in a healing. It's just going to hold by a suture. So that type of the tear, I usually perform partial meniscectomy. I remove torn meniscus. Once I remove the torn meniscus, usually pain is reduced. And rehabilitation process just for partial meniscectomy is much faster than for a repair of the meniscus. There is a medial and lateral meniscus in the knee, and usually if they have injury to each of them, with objective finding during physical examination, you can feel which meniscus is injured. One of the studies that I perform to identify if there is a meniscal tear, it's a MRI, or magnetic resonance impulse. The MRI will clearly show any meniscal pathology. Now, is any meniscal tear have to be treatable? If there is a small tear that does not cause any problems and patient really not active, I would leave this meniscus alone, treat it non-surgically. I only treat the injury that accompany with pain and disability of the patient. In some younger patients that have meniscal tear, once they meniscus dislocated, they lock. Once they reduce, they have less pain. For patient with that type of injury, of course, I would recommend to repair that meniscus and avoid that unnecessary feeling of locking of the knee in certain activities.